Hello everyone and welcome. Today we're diving deep into a respiratory illness that affects people of all ages, but is particularly dangerous for infants: pertussis, also known as whooping cough. Pertussis is caused by a highly contagious bacterium called Bordetella pertussis. This bacterium attaches to the cilia lining the upper respiratory system, damaging them and causing inflammation. It spreads easily through the air when an infected person coughs or sneezes. Direct contact with respiratory droplets can also transmit the infection. Once Bordetella pertussis enters the body, it releases toxins that damage the cilia, tiny hair-like structures that help keep our airways clear. This damage hinders the lungs' ability to remove mucus and debris. The toxins also trigger inflammation and swelling, leading to the characteristic severe coughing spells and making it difficult to breathe. Pertussis is a global concern, affecting millions worldwide each year. While vaccination has significantly reduced its incidence, outbreaks still occur, especially in communities with low vaccination rates or waning immunity. Infants who are too young to be fully vaccinated are at the highest risk of severe complications and death. Adolescents and adults can also contract pertussis, often experiencing milder symptoms, but they can still transmit the infection to vulnerable infants. The hallmark symptom of pertussis is its severe, uncontrollable coughing fits. These fits are often followed by a characteristic whooping sound as the person gasps for air. Other symptoms may include a runny nose, mild fever, and sneezing, similar to a common cold. Especially in the early stages, the coughing can be so intense that it leads to vomiting, exhaustion, and even broken ribs. Infants may not exhibit the classic whoop, but can experience apnea, pauses in breathing, which is extremely dangerous. Diagnosing pertussis involves a combination of clinical evaluation and laboratory testing. A healthcare provider will assess your symptoms and listen to your cough. A nasopharyngeal swab, where a sample is collected from the back of your nose and throat, is used to detect the Bordetella pertussis bacteria through a PCR test or culture. Blood tests may also be performed to measure antibody levels. Pertussis is generally described in stages. The catarrhal stage, lasting 1-2 weeks, mimics a common cold. The paroxysmal stage, lasting 1-6 weeks, is characterized by intense coughing fits. The convalescent stage, which can last for months, involves a gradual reduction in coughing severity. Treatment for pertussis typically involves antibiotics, such as azithromycin or erythromycin, to kill the bacteria and reduce the duration of the illness, especially if administered early in the course of the disease. Supportive care, including rest, hydration, and managing cough symptoms, is also essential. For infants in severe cases, hospitalization may be necessary to provide oxygen, monitor breathing, and manage complications. It's important to consult with a healthcare professional for proper diagnosis and treatment plan. The most effective way to prevent pertussis is through vaccination. The DTaP vaccine is given to infants and children in a series of doses. A booster dose, the DAP vaccine, is recommended for adolescents and adults to maintain immunity. Pregnant women are also encouraged to receive the DAP vaccine during each pregnancy to protect their newborns. In addition to vaccination, practicing good hygiene, such as frequent hand washing and covering coughs and sneezes, can help prevent the spread of the bacteria. The prognosis for pertussis varies depending on the age and overall health of the individual. Infants are at the highest risk of serious complications, including pneumonia, seizures, brain damage, and even death. Adults and older children generally recover fully, although the cough can linger for several months. Recent research focuses on developing more effective vaccines and exploring new treatment strategies to reduce the severity and duration of the illness, particularly in vulnerable populations.